WashingTECH.
Hey, it's Joe, and I don't have to tell you, relationships are critical in Washington. But how do you, A, find out who the key players are, and B, figure out how to reach out to them? Well, I want to tell you about Leadership Connect. It's been an absolute lifesaver for us as we expand our operations and outreach here at WashingTECH. Leadership Connect, it's the digital service used by top federal contractors and government affairs leaders to contact decision makers and develop those strategic relationships. Visit leadershipconnect.io and join the community. I love it, and I'm 100% sure you will too. That's leadershipconnect.io. Try it now.
Support for this podcast has been provided by referrals.internetassociation.org, Internet Association's new job site. IA understands and helps shape policies for its member companies. Collectively, they understand their platforms and services perform better with the perspectives of diverse employees and users who share their experiences. Visit Internet Association's job referral site at referrals.internetassociation.org to view and apply for openings across participating IA member companies. By partnering with leading civil rights organizations, including AnitaB.org, the Bipartisan Congressional HBCU Caucus, the National Urban League, and the Thurgood Marshall College Fund, IA's job site is a new resource for historically underrepresented job applicants interested in working in the internet industry. Visit the site today at referrals.internetassociation.org.
One story would be do this, another story would be do that. And that kind of conflicting information in the aftermath of a major event like this is dangerous.
Welcome to the WashingTECH Tech Policy Podcast.
From Washington, D.C., it's the WashingTECH Tech Policy Podcast.
With Joe Miller.
Joe Miller.
Let's end the cliche. These things can't happen overnight, shall we? We've been talking about hate speech on the internet for over 20 years. Mark Zuckerberg's had a predilection for hate speech as long as we've known him. Facebook has been a safe harbor for bigots since it launched. Listen to this, March 18th, 1999. The New York Times posts a lesson on its learning network about hate speech. One of the questions they asked students had to do with whether or not the internet should censor websites promoting groups that promote hate speech. November 19th, 2003. The Harvard Crimson quotes female students, one African American and one Latina, outraged about face smash, Zuckerberg's first Frankenstein, created so students could rank each other's attractiveness. You probably remember this. Face smash, of course, is smash face in reverse, a term that's long been used to call someone ugly. It's a frat boy. Dude, he's a smash face. So face smash. He thought that was very clever, I'm sure. November 15th, 2007. Going on 13 years ago. Over a decade. This is 9 months after Facebook's launch. Christopher Wolf, a former chair of the International Association Against Cyber Hate, writes a New York Times op-ed entitled "The Web Fuels Hate Speech." You know the rest. Monica Bickert, Facebook VP of Content Policy, announced Monday, October 12th, that Facebook will no longer permit Holocaust deniers on the platform. Well, it's about time. The German Marshall Fund reports nearly 2 billion engagements on misinformation coming from Facebook pages, roughly 3 times the rate it was in 2016. Misinformation is more popular than ever. Here's the kicker, though. Read all the way down to the end of Monica Bickert's statement, to the last paragraph of Facebook's announcement. Quote, enforcement of these policies cannot happen overnight. There is a range of content that can violate these policies, and it will take some time to train our reviewers and systems on enforcement. We are grateful to many partners for their input and candor as we work to keep our platform safe. It's been 20 years. If he'd been paying attention in 2003, 2004 when he launched Face Smash, hate speech on the internet was already an issue. Facebook launched in 2007. Wasn't that enough time to put the right controls in place? 3-4 years before it launched? We started talking about hate speech in 1999. Fantastic, though, Facebook. You're awake. Welcome. You need more bulletproof coffee. That's not a plug. Now, how about some of these other issues? You've set the precedent. By the way, why didn't you flag President Trump's false statement about his COVID situation? Twitter did. He said he was immune because he had it. That he was immune. He goes around and shakes hands at these whatever. YouTube is now on the fence about whether it will ban QAnon, even though the group is tearing people apart, which Travis Andrews writes about in the Washington Post. YouTube CEO Susan Wojcicki says the company is now flagging QAnon content borderline, saying COVID-19 comes from people who eat bat soup, and Democrats are operating a sex trafficking operation without evidence is borderline. Things that have no basis in fact are misinformation, period. Especially when it affects the discourse as it has the entire fabric of our society. If it's satire, flag it as satire. But lies are not borderline. It's impossible for hate speech to be free. Just like it's impossible for forced segregation, separate but equal, to be equal. The Supreme Court's holding in Brown v. Board of Education, which even Amy Coney Barrett describes as a super precedent, one of those exceptional cases that should not be overturned. Great Thurgood Marshall argued before the court in Brown that it is impossible for segregation to be separate but equal. It's impossible for segregation to be separate but equal. The same logic applies here. Brown applied the 14th Amendment. We just apply the First. It's impossible for hate speech to be free. But let's look at Microsoft. Microsoft's making progress. The company won a court order to take down an election interference botnet network called TrickBot. So if a company like Facebook, like Twitter, YouTube, and Microsoft want to do something overnight, it absolutely can. It absolutely can. There's the thing about hate speech on Holocaust denial on Facebook was starting to percolate last week. It was trending. And they responded immediately. File the motion like Microsoft did to stop TrickBot. Make changes. Iterate quickly. Be agile. Isn't that a buzzword now? Agile project management? Let's get agile with this. Borderline. Dr. Alison Holman is professor of nursing at the Sue and Bill Gross School of Nursing and Department of Psychological Science at the University of California, Irvine. She's worked on September 11th, looking at the health effects on the populace after September 11th. She's worked on a variety of other collective traumas. Please welcome Dr. Alison Holman. So I wanted to bring you on to talk about your fascinating paper. I mean, so many people are struggling with mental health issues during the pandemic, not to mention those who were suffering from it before. And you and your colleagues wrote a fantastic paper looking at the effects of media during this crisis while people are holed up. And I just wanted to get, kind of give folks some exposure to it, and hopefully they'll go to the show notes and download it and read it for themselves. But tell us about the problem you were trying to solve with this research.
Okay. Well, my colleagues and I have, for many decades, studied how people cope in the immediate aftermath of these kinds of collective traumas. We've studied things like wildfires. We've studied 9/11, Boston Marathon bombing, Orlando nightclub shooting. And one of our major interests is in understanding the very early responses that people have to these events so that we can then see and understand what are some of the predictors of those early responses, so we can then help inform interventions in the immediate aftermath to try to prevent downstream problems from happening, mental health and physical health problems. Our work has focused largely on mental and physical health consequences of these collective traumas. And so doing this work in the immediate aftermath of these major events gives us that opportunity, that unique opportunity to look into the window of what is that early response like, what are the things that are contributing to it, and how can we inform people who create interventions in the immediate aftermath of these events to help prevent those downstream effects.
So you're not saying that we're in the aftermath now of the COVID-19, you're just saying the aftermath of the initial period.
Well, let me just say, COVID is a very different animal. Yeah. Most of the events all of the events that we've studied in the past have been events, like I mentioned, wildfire that comes and is over, 9/11, which was an attack, but there were no, the planes didn't continue to fly into buildings, and the Boston Marathon bombing and other places where the event happens and it's over. There's still an aftermath for the event. But what we're living through right now is not the same thing. It is a chronic, ongoing stressor that is collective stressor that is being punctuated by these acute events that keep happening. Case in point, for our country in general, the president being diagnosed with COVID-19 was an acute event that many people in this country may have, experienced as a very stressful experience. Along the lines, since the beginning of the pandemic in the United States, there have been many such events. And at an individual level, some of those events include being diagnosed, or having a loved one diagnosed, or having a loved one die, or other things, which I would call those are the acute stressors that punctuate this chronic stressor called COVID-19. There have been other studies that have looked at mental health-related issues in COVID, but they've used samples of people that are volunteer, basically, completely volunteer samples, online samples where you can, go into SurveyMonkey, or you can go into some of these online programs that can let you get people opt into a panel. Those kinds of studies are not representative of any population because people choose to come into them, and we don't know what are the unique qualities of the people who choose to go into them. Our study, on the other hand, is done with a random sample of the population in which people don't just choose to come into the study. They are randomly sampled by the survey research company. So our sample is different. It is a truly representative sample of the American population. And then what we do is those companies always have collected, when they bring people onto their panels, they bring them onto their panels with having collected health data. So they have mental health, they have physical health data, they have data about their attitudes, about their beliefs. They have a ton of data on them. So we get that data that people gave before the major stressor hit, and then see how did that information change in the aftermath or in the ongoingness, I guess, of COVID. So by using this, it's a truly representative sample. The demographics that we include are, age, gender, race, ethnicity, education, region of the country you live in, type of housing you live in. Are you in Are you in a rural area? Are you in a suburban area? Are you in an urban area? So we look at a variety, income. So we look at a variety of demographics.
You absolutely can't get that kind of quality by using SurveyMonkey and some of these other platforms. Presumably, you're going to be trying to get paid traffic to those surveys. You're going to have to advertise.
Correct. And people opt into those panels. So what is it about that individual that made them opt into a panel? When people choose to come into a study, you don't know if they're choosing to come in because they're particularly distressed, or if they're choosing to come in because they aren't particularly distressed, because maybe they have, whatever. I mean, there could be a million reasons why somebody chooses to opt into a panel. We don't have to worry about that. We had 6,514 respondents across the country from the AmeriSpeak panel, which is a random sample of the American population.
Tech policy is global policy. This is the WashingTECH Tech Policy Podcast, serving the world.
So what types of media did you look at here? I'm assuming you didn't just look at social media.
We include in our studies assessments of traditional media, which we look at. In that case, we talk about television, radio, newspapers, etc. And then we also have online media. So people, we have questions about when people, you can actually use the television or read a newspaper, a print newspaper, but you can also read things online. So we look at online sources, and then we have special questions we also have questions specifically about social media sources. So we have a variety of sources that we include in our assessments to see how different types of media impact people's responses. This particular study did not. We were looking at the total overall media consumption and the nature of the information that they were giving.
So what did you find in this study? And I mean, this is a time when misinformation is top of mind for everyone. How does misinformation affect mental health?
What we were trying to understand was what are the early predictors of acute stress response. Acute stress response is early, like post-traumatic stress type symptoms. So ruminating about things, waking up in the middle of the night, thinking about things, being on edge, etc. And depressive symptoms. So we looked at both acute stress symptoms and depressive symptoms. And what we found was that the people who were at greatest risk for reporting these kinds of symptoms were individuals who had experienced prior mental health problems and people who experienced a lot of the secondary stressors in the immediate aftermath of the pandemic and the media. So those three things stood out as the critical predictors of acute stress and depression in the aftermath. In particular, the kinds of secondary stressors, when we talk about secondary stressors, we talk about things like losing your job, losing wages, having to homeschool your child or things like that, when there are many secondary stressors that people faced in the immediate aftermath. In addition, when we looked at the media stuff, one of the important variables that we included in that was conflicting media and whether people were being exposed to news media that was giving them different stories. So one story would be do this, another story would be do that. And that kind of conflicting information in the aftermath of a major event like this is dangerous because it confuses people. When you give people accurate information and you give it to them in a non-hyperbolic way, not to trying to rouse them up, when you give people accurate information, people are able to understand it. And they're able to respond appropriately. So when you give them facts, when you give them things that they need to understand, they'll cope with it. So those were our findings. The more you watched the media, the more you engaged in the media, the more conflicting information you got, the more secondary stressors you were exposed to. And if you had a mental health problem prior to COVID, all of those were major contributors to these different symptoms over time. And we're actually in the field right now with our second wave of data collection right now. And we're hoping to understand how people's emotional health and well-being have changed over the last 6 months and be able to see what are some of the early predictors of people's responses now and how might we help people as we move forward.
So what scares you the most about this? What do you think what are the societal implications of all of this? When you were conducting this research, like the rest of us, there had to be a fear component once you saw the feedback.
Well, the societal implications are that we really need to get a handle on how to provide people with the accurate information that they need to be able to cope as this pandemic goes on. And that we need to, we've said this for many years, and I'll repeat it now. Overdoing the media exposure is really not good for you. It's really not good for your mental health, and it's not good for your physical health. And we know that from our research. So it's important for people to not engage too much with the media, get enough information of what you need, and turn it off otherwise, and find the most reputable sources like the CDC and the World Health Organization. We really need to understand how to talk to people about this pandemic and give them straight information.
Alison Holman, professor at the Sue and Bill Gross School of Nursing at UC Irvine. Dr. Holman, thanks for joining me.
You're very welcome.
That concludes episode 245 of the podcast. Thanks so much for listening. If you like what we do, we'd love to hear from you. Please take a moment, head over to Apple Podcasts, leave it a review. It helps others know what they can expect from the show and really helps us out. Thanks again for listening, and I'll see you back here next week. Take care.
WashingTECH.